My father went through a stroke. Yes, you heard it right. And this is something very personal. And this is why I didn't want to talk about it at the start until things went well and the case is stabilized. But why I'm sharing with you something too personal like that? It is the same reason why I started to talk about blood clots. So you're gonna have to understand that in life we're gonna encounter some stuff with people that we do care about. And the problem is mostly if we don't have enough knowledge and enough practice, we will not be able to help them. And I'm sharing this with you so you learn that these circumstances need a huge knowledge to can first give the family a little bit of a comfort because everyone gonna panic. Second, you have to have a framework or at least identification for what could be happening because some people get into the situation to develop a blood clot or get into a stroke without having without noticing these effects. So that's a bad thing also. And if you don't have enough knowledge about the matter, it will cause you a lot of problems when you deal with medical doctors or conventional medicine because sometimes they get things wrong, or at least they don't fetch for the root causes, or they just want to stabilize the case and not manage the root cause and don't help a lot. And the mix of medications that they put people on, sometimes it can put those people in a further risk for developing something else. And I'm really sure that most of people get bored from the post that I keep posting, but it is essential to understand. And the hematology is one of the major driver for many cardiovascular diseases, or it is the start of some of the cardiovascular diseases. And then this is why I started to post a lot about hematology, and I started to talk about CBC, and then I moved into the blood clots and clotting factors. And this is why it's a complex one, and people don't realize how much this impact others, and this how common it is to develop a blood clot. It is very hard, and blood clots can then lead to some further complications like strokes. And not all blood clots are the same, and at the same time, not all strokes are the same. And I'm sharing that to you because my father suffered from ischemic stroke in the brain, and thank God that it was just a little bit, like a few millimeter above the nucleus accumbens, and if it was a little bit lower or larger, it could cause a huge motor disability, which we are really thankful that this didn't happen. However, the problem starts from the identification of the problem or even realizing that something went off with him. If you have someone who you care about and then this person start to be slower, start to be more quieter, start to be more of a different person, you need to have something to test for. And mostly it is an MRI on the brain because something is off with them. If your person, like in my case, if my father always been talking too much, not too much, like talking a lot and engaging a lot. He has his own temper and he has his own energy and vibes on the family and at the house. And he just went a little bit silent, and this drive up our curiosity what is going on, because also I have been giving them instructions like don't ignore this signs. If you have any problems, because also he is over 60 and my mother also, and this makes you always try to educate them about what they look for, what they care about, what they um don't skip. And it's good that we are taking care of them from the nutritional side, from the supplemental side, and also we have irregular blood work and sometimes organ imaging. And this made a huge a huge factor in the recovery, or even from the start, from the ischemic stroke start. And it has not always been easy to identify the root cause of stuff that happens, and even science most of the times failed to give people the understanding of from where the disease could start. But at least you prevent the progression, and you prevent any complication that can happen, and you stop this from reoccurring. This is the major thing. So with what happened to him is like he started to be quieter. Then everything was fine. Like his motor activity was fine, but it is like less. So upon an MRI, the MRI showed that there is an ischemic stroke that happened already. So it was happened like 3 days ago. So you can't take him to the ER. You can't give him the injections. So he is now need to be like stabilizing the case. So from this part, you're gonna need to know what to talk with your or with their doctor about, because most of the doctors comes in and then ask for some labs, some, not a lot. And if they don't have the history, they don't ask for it. They actually work as I have been told, as per the guidelines. So when you talk to a doctor and you start to have a conversation with them, sometimes they are not open minded enough to can talk about it and to can have someone to discuss with, especially if you don't have a medical license, and they dismiss everything that you're saying. For example, when you ask at the start, they give you like a list of medication, and they never ask about more lab works. They ask for lipid profile, and then the coagulation factor like PTINR, and that's it. Sometimes maybe they ask about ESR, but they don't ask about ESR. They don't ask about CRP. They don't ask about more of an investigational coagulation factors and stuff like that. So you'll be willing to investigate those furthermore. And thankfully enough that we had done a lot of blood tests to him to can ensure that these things, the prediction or the expectation to have something like that is very rare. So when it happened, but it wasn't severe, and it wasn't that intense. So it was under control, which we are thankful for that. So then doctors start to put him on different anticoagulants, and for sure, they put him on aspirin, and regardless of his platelets, regardless of his everything, and also, they wanted to put him on a statin, regardless of his LDL, which is mostly like 110, and other different medications. And the problem with that is the selection of the medication itself. It is really, I would say, a mess. Why? Because first they started to choose statins that mess with blood glucose levels, that can drive up diabetes profile, and then it also can lower the testosterone levels, and at the same time can cause muscle weaknesses, and that can impair the quality of life of the person. So you need to be careful with what you're doing. And then, why would you use something like that if the person himself doesn't suffer from major inflammation, doesn't suffer from any problems with apoproteins and lipoproteins, or even anything in his lipid profile? Even when you talk about lipoproteins and apoproteins with a doctor, man, this guy is rolling his eyes. I'm not discounting those people's knowledge, and I'm not saying that those people are useless, but sometimes they need to step up their knowledge, and they need to understand the difference between knowing the guidelines and understanding that guidelines from where it came from, and to understand your patient case. And this is why you need to be careful with dealing with doctors, because sometimes they have a generalized guidelines that it is not specific for your case or your patient or whatever the person case. So it is very bad to go with that advice without investigating what is this medication for, what is the dosage, for how long should I be on this medication, what would the medication can interfere with, and do not ever uh, do not ever skip discussing the vitamins and mineral status with your doctor, because sometimes those medications can mess up with a lot of things. Like statins can lower the potential of the coenzyme Q10, which can have a plethora of side effects, especially cardiovascular effects, that you are trying to prevent another cardiovascular event if you care about that. And also, there's a big difference between ischemic stroke in the brain and stroke in the heart or in the arteries or anything else. We did a Doppler scan for him, and all arteries were clear. And we did an echocardiogram, and it was almost perfect for not even for his age. If I shared the blood work, echocardiogram, and the CT scans, the Dopplers that we did, you definitely will not be telling that this is even 30 or 40 years old guy with the numbers there and the clearance and the ejection fraction on the echocardiogram, which we are again thankfully for it. So the thing is, I know that this video is really really painful to do, especially after what happened. But I'm just giving you things to think about. Why you develop knowledge? You develop knowledge about health to make benefit from for yourself, for your significant others, for others that you care about. That's it. So you don't go to get information about peptides, supplements, this, that for no reason, because you have to make use of it for yourself, for others. And I had put them, both my parents, on a lot of things, not research chemicals per se, but at least preserving their health with some pharmacological interventions, which I'm really thankful that I got to this point that they can give them some good advice that their doctors still couldn't navigate through, especially my mother and my mother case through 2020, and it was a disaster back then. Maybe later on, maybe sharing the story about that, because also it has a lot of things to can learn from, especially if you are managing a diabetic profile that went through ages of misdiagnosis and a lot of other stupidity, especially with women's, with the the diagnosis and the understanding of the hormonal fluctuation when they are in the perimenopausal and then postmenopausal state, and how that can reflect to their symptoms, and managing the status, and all things can go through that. And it's really bad when you talk to medical doctors that they don't really have a good grasp on this stuff, because you then will lose interest and lose faith on those people, simply because they dismiss everything. And I always get them into the thinking and ideation about, during the COVID time, it was the protocol. It was only like they are trying to increase the immunity, so they advise people to take D3, zinc, vitamin C, and if someone has a fever, they take paracetamol, and if someone has a coughing or something else, they will take antibiotics. So I told them, if vitamins and minerals wasn't important, that wasn't be the protocol for the bug during, or for the COVID at that time. So anyway, back to the story. So if your doctor told you to stop your vitamins and minerals, you have to ask for a reason. If there is no clear reason, you dismiss them, literally dismiss them. Because if you ask your doctor and he didn't have you know I would say a reasonable explanation why you should stop your vitamins, you don't need to follow their advice ever. When you have someone, you want to put them on any kind of a dose with a blood pressure medications, for example, you need to clear things up: hydration, mineral status, electrolyte status, magnesium status. They ignore everything. This just said to you, drink as much water as you can. But water is not hydration. Actually, hydration is mostly electrolytes plus water for sure. And then when you look into the development of cardiovascular events or the hematology itself, it comes from not only a thick blood, it comes from a genetic predispositions. So if you don't have a gene screening prior to that, and you look into the coagulation factors, the factor Lydin, and other stuff that I shared about, you'll be always like questioning what is going on. And then if you don't have a prior examination, like when you are healthy enough, a lot of people dismiss that. And if you are healthy enough, you should have a blood work, an imaging, organ imaging, because you wanna have a trend. This is the blood work when I was perfect, almost perfect, and this is my blood work right now, so I can see the trends. Like, what was the change? And you need to know your starting point, because sometimes numbers is not giving you the full story if it's during the disease time. If you don't have the starting point, because let's say, for instance, some people have a genetic predispositions to have a higher LDL naturally without having any intervention. If you don't know that from the start, you'll not be able to tell that, okay, those people are fine on these numbers because their body actually accommodated this as a genetic thing. Doesn't matter that you shouldn't or should have something to combat that, but it's a thing. So it's hard to can give people things um, and understand the need without giving them live example. And this is why I'm sharing those informations, because it's a live example that I couldn't stop talking about it, and I couldn't stop telling people about it. This is why I actually started to post on blood clots from the second week after we got this thing going with him. And I felt the need to educate people on, it's not the stroke, but on things that can lead to that. Because also we had a lot of family members that they were unfortunate enough to get into plaque buildup that led to a blockage, and then they had to go on a surgery and have stents, and some with a bypass surgery and stuff like that, which is really putting you in a very fragile uh, place. If you got yourself into the hypertensive crisis, you could lose your life immediately. So navigating through things like that needs a huge knowledge based information. And why I'm saying knowledge based information, because not all the information should be deal you shouldn't deal with most of the information as knowledge. You should deal with the information as a potential knowledge base, because if you don't have an action out of an information, it's not a knowledge. This is my identification to that. So a lot of people talk about a lot of stuff. I can talk about geek stuff, and I'll make your head spin on things that you don't understand, but this is not actionable information. I can discuss things on a cellular level, but why? I just, if I talk about complicated stuff, I talk about it because I want to lead that into an actionable thing. Anyway, so with that being said, all of those 20 minutes ranting, it's all about how to manage, or how to really feel like knowledge nowadays is obligation. You are obligated to get knowledge on everything, on a lot of things. I have many problems that I encountered through my life, and it started with myself. Like, what is sparked my interest into all of this space is only my own issues at the start, from childhood till adolescent age, and then I had to navigate through it myself. Yeah, and that led me to this position right now. And then, you know, my son, and then my mother and my sister and my father, and other family members and other friends that went through a lot of things. So, I'm feeling lucky enough to help them, but at the same time, you need to be there on time to can have an immediate intervention. And then, if you don't have the proper knowledge, you'll not be able to give them the directions, and also you'll not be able to comfort them. If someone got an information that someone got struck, you could get a stroke too from the sheer amount of stress that you are experiencing or that you are under, which is an unfortunate. So probably this video is not something I would say sexy enough for people to watch till the end. And the takeaway from this is only one thing: knowledge is a power that you need to power yourself with and weaponize yourself with, because one day you're gonna regret not being informed, not having the proper information, the proper knowledge on a stuff that you needed at the moment for your loved ones, or for the people that you care about. And you're gonna need to educate yourself on many stuff, actually on all the stuff, because you're gonna find it in yourself, you're gonna find it in your kid, you're gonna find it in your parents, in your friends. Like, you can see your friend and looking at their eyes and tell them, go check for this and this and this, look like you have this. And then they go check and they find themselves, they have wrecked kidney. It's a bad, it's a bad thing. So, these things are really helpful if you have it, and really painful if you don't, because the last thing that you want is going to a doctor, don't know what you have, don't know what to do, don't know what to discuss with them on, and then get out of their office with a list of medications that afterwards you feel worse. Yes, your case from this specific symptom or this specific event was resolved, but in the longer run, you started to develop a lot of other cases or a lot of other problems that you had been away, far away from it. Just your ignorance led you to that point. And again, it's not something that I'm talking about to talk shit on doctors or convention medicine, but it's something painful, really painful to see this is happening. And people, or they don't realize that they are not doing anyone favor. They actually can kill people with this practice. And under do you and I don't know, like, if you don't know how to differentiate between things, you shouldn't have a license, in my opinion. Anyway, so that was the whole thing. I don't want to rant more on that. So that's it. Hopefully that you get something out of this video. And I know that I'm still scattered. I'm still all over the place. But I had to talk about it because maybe this can give you the encouragement to keep up your knowledge and keep accumulating more knowledge, so you can be a helpful member in your community and family and stuff. So that's it.